This is my question to you. Before you walk into an emergency room, have you evaluated their balance sheet or quarterly financial filings? Well, that's where you messed up. America's hospitals are no longer about healing. They're about margin. And one chain in particular, HCA Healthcare, has turned that into an empire. Let's start with the national picture. U.S. hospitals collectively pulled in roughly $1.5 trillion in 2023. Average operating margin, about 5%. Now that's reasonable. But then you've got the for-profits, which are averaging 14%. That's Wall Street territory. As a matter of fact, it is Wall Street territory because HCA Healthcare is publicly traded on the New York Stock Exchange. Either way, hospitals now charge, on average, $417 for every $100 of cost. And some of them, the top 100, charge as much as $1,800 for every $100. Those are pretty good margins. You don't need a finance degree to see the problem. That's not healthcare. That is predatory. Now, not every hospital is a part of this mess. Take Johns Hopkins, right here in Baltimore, for example. It's nonprofit, it's transparent, and it's accountable. Hopkins runs pretty tight margins, 2 to 3%, and whatever surplus they make pretty much goes right back into research, training, and patient assistance, which is where that money belongs, right? Every year, Hopkins reports hundreds of millions in uncompensated care and community programs. They're not perfect, but they prove you can run a world-class institution without squeezing your patients dry. Then there's HCA Healthcare, a 180 hospital empire stretching across 20 states. In 2024, HCA pulled in $5.7 billion in profit on $70 billion in revenue. What did they do with it? They spent $6 billion buying back their own stock and another $688 million on dividends. While you were calculating your deductible, HCA was figuring out how to pad their own pockets. But this isn't even new, because in the 90s, they paid $1.7 billion in Medicare fraud penalties. Decades later, same game, shinier branding. So let's call it what it is. A moral failure. Every dollar HCA spends enriching its shareholders could have covered care for the uninsured, expanding trauma centers, or funding cancer research. And here's the best part. This isn't a left or a right issue. Every American should be infuriated by this. So, if the American healthcare system feels broken, that's because it has been hijacked by corporate greed. I'm Gray Ledger, and this was the Ledger Brief.